And why do dentists fail in that? What's the reason for that? I identified multiple reasons, but first of all, a lot of dentists fall into preventable traps. These are things that mistakes that I've made, over the past 20 years. These are mistakes that many clinicians have made. Everybody knows them. You just need to know about them so you don't fall into this hole, into this trap, and get hurt. For example, placing an implant next to a canine. Everybody knows the canine has a distal tilt, 99%. This is a preventable problem. But what are the other reasons dentists fail in placing aesthetic implants? First of all, dentists don't think restoratively when they're placing. They're thinking about the bone. They're thinking about how to anchor the implant, about stability, and that's important, but not thinking about the restorative position. Okay, so if you failed in that aspect, that's where you can improve. Many dentists fail because of rushing, doing things quick without giving it a thought, without planning, without taking a time out and figuring out, okay, what am I going to do here? Rushing is one of the biggest pitfalls you can find. And it's almost the source of all evil in my world. So when you see me operate, and it's pretty much to how I talk to you right now, it's very slow, calm, composed, with a lot of thought, because if I'm going to rush, I'm going to put myself at a disadvantage and I'm going to fail. Many dentists fail because of the wrong case selection, picking up loser cases, hopeless cases, patients that cannot be made happy, for example. You pick those cases, well, yeah, every once in a while you're going to pick a hard case, but if you pick those cases, you're going to increase your failure rate. 80% of your work needs to be predictable, simple, streamlined. Yes, 5% may be difficult, but you want to treat mostly predictable cases, and this is all about case selection. Dentists fail because they don't have systems or protocols. For example, they don't take x-rays during the procedure. They take the x-ray at the end when it's too late, for example. They don't follow the system of using the right tools at the right time. Big problem. Some dentists fail in case presentation, in case acceptance, and not setting the right patient expectations. Over-promising and under-delivering. We want this to be the opposite. Okay, that's a learned skill, and I learned this over the years, and I teach this in our advanced training. Dentists can be great in implant placement, but very poor in post-op instructions, giving the right medications, managing pain. If you don't do this the proper way, your implants are going to fail. And even if they don't fail, if your patient has a poor experience, you're not considered a good doctor. You're not going to get the goodwill. You're not going to get the referrals. You're not going to get the trust and appreciation of the patient, which is so important to build a brand and to build a practice. And if you knew how to give the right post-op instructions and monitor the patient, you'll get much better success. Dentists fail because of no guidance, no mentorship. I think this goes without saying. And of course, present company excluded, because you are seeking mentorship and you're seeking to learn and to better yourself. And many dentists fail because they ignore the soft tissue. And this is huge. When you fail in the soft tissue, even if your implant has great bone and has integrated, the soft tissue is going to ruin the whole case.